Everyone, we are live once again, back here again for another week of our Native Strong weekly town hall on the COVID-19 pandemic and the ongoing response to that pandemic, which of course lately is focused on vaccines, continued rollouts in different phases. We are now in phase 1B. The Gerald L. Ignace Indian Health Center, along with some cooperation from Wisconsin's DHS, has entered into a little collaborative efforts, I guess. Next week, we'll be holding a Native community vaccine event. Dr. Ignace will definitely get into that a little later in the presentation, but just wanted to mention that right off the bat. You can register a few different ways, but first way, just head to our website, check that out. You can register there. Again, Dr. Ignace will get into this later. But for all of you joining us for maybe a repeat affair, we do welcome questions. Jump in through the chat bubble via Zoom, or also you can, if you are tuning in via Facebook, just drop in a comment, and I'll be moderating those while our great friend and colleague Mark Denning, who's been here since the beginning with us, he'll be here moderating the Zoom call, as well as bringing his voice from the community as well. So with that, I'm going to pass it over to Mark, and thank you all for joining us again today.
Bueno buju endo e maganaduk, naro e benezi indigenous cause the man do them, Anishnabi and Dow, the open in Donjaba. I want to say hello to everybody that's out there and on this particular program. I think, Jeremiah, are we going on our 49th or 50th week right now?
I want to say 49.
I think this may be week 49 straight weeks of native to native conversations. And this is probably one of our more important conversations because of the news that Dr. Ignace is going to be talking about. And I don't want to step over that news because there has been announcements about it, that being that in a cooperative moment, governmental organizations, along with Dr. Ignace's approval and this work that's been done and awareness that's being done on this program and by a relative speaking, we're trying to address COVID-19. Over several weeks, our community's been #2 in transmission and #1 in fatalities. Make no mistake, some of our families, because of our extended family relationships, some of our young people, older people, have been in a constant state of mourning for several months. And there's great news coming that we have a moment where the tier 1, tier 2, tier 3 sorts of programming is going to be modified for our community, because people understand the difficult moment that we are in. The disproportionate effect that COVID-19 has had on all of us. Remembering that Milwaukee is the largest population of Native American people. And today I'm both happy and angered, and I'm going to share why. This program is not in the business of facilitating comfort to those who would work against our community. And I've run into that. And it does anger, meaning we have good news for our community where folks can step up and get vaccinations where they couldn't before. Dr. Ignace is going to talk about that. We have a Native organization out there, and I'm not going to name it, but that will not be letting people know that this program is available because they believe that the families, our Native families, of course, we've intermarried with other cultures. And they don't want to be bothered with answering the phone and answering questions. They don't want to be bothered with creating hard feelings that some people get and some people don't. That's not what this is about. This is about saving lives. And this is about giving people hope, where a lot of us have just been on standby. So this is why these programs are important. We're not just talking about COVID-19. We're talking about institutional racism. And when that institutional racism reaches into our own community and has our own Native voices and people that work in our community, say they won't talk about the health of our community. That's a problem for me. And I hope that's a problem for you. So please get this information out that we're talking about, because in a sense, we're not only working against those that would do our community harm by not paying attention, chosen ignorance, but those who look at news and decide they don't want to be a part of it because they might be offensive or have to answer questions instead of referring those questions to our healthcare providers. So that's it for me. I've departed from my usual conversation that, you know, we have these moments where we have the privilege of being online. We have the privilege of asking questions for others that don't have web service, that don't have computers. And we know who they are, and we try to talk to them as best we can. So with that, I'd like to turn this over and focus on the very good news for a while, and also the challenges in front of our community. And we're hoping each of you watching are going to be a part of a positive solution and not get in the way of progress. So Dr. Ignace, I'm going to turn this one over to you, and away we go. Dr. Ignace.
Thanks, Mark. Thanks for the commentary. I appreciate it because, as well as Jeremiah, the news that I'm going to be talking about here in a moment, but the effort of vaccines obviously is at our doorstep right now with the Moderna, Pfizer, and with the authorization of Johnson & Johnson. This forum that we talk, Jeremiah, Mark, and myself, it is really to provide the information to allow people to make informed decisions for themselves. Obviously, Native individuals speaking directly to Natives. And so this has been going for 49 weeks, and it's intended to reach what otherwise may not be an opportunity for Natives. And this health center has been diligently trying to be on the forefront in being able to offer the benefits of not just providing information, but providing health services. And if there's an opportunity, and I've been talking about vaccines for months. And so what has happened most recently is an opportunity that I felt was important to support our Native community here in the Milwaukee County region. So within the last week, I've been in discussions with Wisconsin DHS and throwing out ideas on how Wisconsin DHS can help support Native communities. So we worked on a pilot project here where we have the opportunity to combine action and effort in a 3-day event where GLIIHC as well as DHS will be offering COVID-19 vaccines to high-risk Native individuals who are Milwaukee County residents. We have an opportunity to, in this moment, to provide vaccines on a large scale over 3 days to who we know are the most vulnerable of individuals in our communities. And that involves our aunts, our uncles, grandparents, our relatives, everyone that we know who hasn't had COVID, fear of COVID, scared of COVID, has laid kind of dormant because of COVID. And this is a real opportunity for individuals, specifically just Natives in the Milwaukee County, to be able to have and get a vaccine over these 3 days. So on March 9th, 10th, and 11th, next week, Tuesday, Wednesday, Thursday, we are taking individuals who are at high risk who meet these categories. Individuals that fit into phase 1A, 1B, 1C, and I'll go through these. But also looking at individuals 18 and older who have at least one chronic condition. Again, this is natives only, all enrolled tribal members or descendants by proof. We will ask you to pre-register. Now, either that you can call our number 414-316-3737 or go online and pre-register there. Someone will contact you with a date and a time when to show up. So we put this announcement out, gosh, I don't know, it's been about 36 hours now, and we've had tremendous response. I just heard Mark comment about some of the responses we get. Now, the reason why this framework was set up was because we know that there are a lot of individuals that don't necessarily fit in this category. I understand that. I appreciate that. But again, we're looking at high risk individuals that are at risk for severe disease based on condition, following state guidelines as well as the guidelines that IHS has put forth that we currently operate under. So it's a blend of both state and IHS, local. This is a grassroots effort looking at vaccinating individuals on a larger scale. So this is really important and something that we've been driving towards because we know the impact. As Mark said, you know, we have the third amongst race and ethnicities. We're the third in the states in case rates. We're second in the state for hospitalizations. We're number one in fatality rate. So this is a time and moment that where state, local, federal agencies such as GLIIHC and DHS come together and actually provide a benefit to protecting the Native community. So I know folks have questions about whether or not they fit in the categories. And it gets a bit complex. But we know 1A. 1A was healthcare workers, essential workers, work in hospital facilities and settings, and long-term care facilities, nursing homes, and assisted living homes. That was 1A. Wisconsin's 1B includes all of these categories. So if you are native or descendant and fall into one of these categories, you qualify. Educators and childcare, public and private, online learning, out-of-school time programs, boys and girls, YMCA, Head Start, K through 12 settings. These are the educators and childcare. Again, long-term care facilities, non-frontline essential healthcare workers, people who work in public health, emergency management, cybersecurity, healthcare critical supply chain functions. On the public sector, as essential workers, 911 operators, utility and communications infrastructure, public transit, food chain supply, agriculture workers, critical workers who work in factories, work with livestock, farms, veterinarians, food production, retail food workers, grocery store, gas stations, you know, convenience stores. If you are native and fall into one of these categories, you qualify for what we are hosting next week. Now, I'll take this one step further in that IHS, which we fall under, allows each tribal entity and each tribe to delineate what their priorities are, what their strategies are to address their Native community that they service. IHS is 1A, healthcare workers, long-term care. 1B, 75 and older, and frontline essential workers. 1C, 65 and older, and 16 to 64-year-olds who have high-risk medical conditions or other essential workers. This is what we're operating under. What we're operating under IHS guidelines is we are further ahead than the state is. So when we look at the eligibility, 1A, 1B, 1C, and because I put the limit at 18 because we have the Moderna vaccine. So 18 and older with a medical condition who fit in 1A, 1B, and 1C are eligible for this 3-day event. As far as who's at risk or at risk for severe illness, we've talked about this before. Individuals 65 and older, nursing homes, long-term care facilities, other high-risk conditions, chronic lung disease, moderate to severe asthma, any underlying heart condition, high blood pressure, cholesterol, people who are immunocompromised through cancer treatment, people of any age of severe obesity by BMI over 40, and individuals who have diabetes, kidney problems, liver problems, pancreatic problems, other conditions such as immunocompromised individuals, bone marrow, organ transplants, autoimmune deficiencies, poorly controlled HIV or AIDS, prolonged use of corticoid and immune weakening medications. So this is just trying to capture as many, but I'll tell you, if you have a chronic care condition that you are managing through, call us. Because more than likely you'll find out you are eligible for this event. And that's going to be important. So the reason why we put these categories is that we have a limited supply of effort here as well. I know the demand is high. We didn't include every category because we wouldn't be able to address all of the high-risk Native individuals here in Milwaukee County. And we had to restrict the area just because of the vast numbers. I'm getting calls from Madison, getting calls from up north, Green Bay, Chicago, Michigan. They've heard about this. I talked to people in IHS, and even a couple hours ago, they've never heard of an event like this occurring, not where there's the cooperation between state and local and federal agencies such as a health center such as ours. It's never been done, hasn't been done in the area. Michigan and Minnesota, anywhere in IHS, they have not heard this kind of event being hosted. So this is a not only unique opportunity, but it is a model that could be replicated to address more and more individuals to get vaccinated. So I agree with Mark in the sentiment that, we know there's individuals at risk, and whether or not it's going to be uncomfortable for individuals to discuss, I don't know if that's your decision. Not when it compromises the health of individuals as a whole. And if we're looking at improving the health and wellness of Native people in our communities, you need to allow them to make that decision for themselves. So, everyone has heard of Johnson & Johnson. Their FDA has approved their emergency use. Last week, they are distributing the vaccine right now. And just a quick highlight of some of the important aspects. Mild symptoms. The side effect profile is smaller. Fatigue, headache, fever, muscle aches, nausea are the main side effects. And if you do, it is mild. It is a one-time shot. Now, the efficacy profile in this is 72% shown in individuals that were enrolled in the United States, 66% in South America, 66% in South Africa, where the mutant variant B1351 was. So It's a one-time shot, and the benefits, if you look here on the right-hand side, you'll see that on the line of severe COVID, going from left to right, 85% after 28 days have been shown to prevent severe COVID. Severe COVID would be sick enough to be admitted to the hospital or into an ICU. And after 90 days has been shown to be effective in preventing death. Not only severe disease, but also death as a result of COVID. All three of these vaccines, Pfizer, Moderna, Johnson & Johnson, all are going to be effective. All are going to be extremely preventative, not only in getting COVID, but also in preventing the transmission. So these are particularly important highlights. Now, as of right now, our facility is getting Moderna. Wisconsin DHS is bringing Moderna. This is going to be a all vaccine event of Moderna. So you'll have your first shot, and we'll guarantee a second shot. And that is already scheduled out for that second shot to be done 28 days from next week. We've been informed that we will not be receiving Johnson & Johnson, the one-time dose vaccine, until April. So all of March, we will be allocated the Moderna vaccine. So just to get a better sense of how things are developing here in Wisconsin, the individuals who've received at least one shot, 16.3% of the state. When we look a little closer, we see that 11.2% of the state's native population has received at least one. Second to our non-Hispanic white population of 15.5, followed by Asian 7.1, Hispanics 4.6, and African Americans 5.1. That is of one shot. When we look at the profile of individuals who received or completed their series of vaccines, 9% of the state to date has completed that. Natives 5.9%, followed by non-Hispanic whites of 8.5, and then all other categories. So when we look at this profile, we see that the native population has been receiving vaccines. They've been receiving on a pretty steady effort. But we know the impact of this is higher and more prevalent in our native communities. And as Mark mentioned, we have individuals who are suffering in silence as a result of this virus. If there was ever a time of immediate impact to reduce this prevalence in our community and change these numbers, would be an event like what is going to be hosted next week. So right now, Wisconsin has administered 1.5 million doses. That's averaging about 39,000 doses. 39,000 doses per day. Around the United States, 107 million doses have been delivered. 80 million have been administered. People who've received at least one dose, 20% of the population, the US population. People who've completed the series, 10.6%, and averaging about 2 million doses per day. So vaccine is getting out. It is in limited supply. The demand is high. Without a doubt, it is high. But it's getting delivered as soon as they get them allocated. If we look at how IHS is faring, of all of the jurisdictions, IHS is number 13 out of 63 jurisdictions. Wisconsin is number 20, Minnesota 22, Michigan 23. And so this is a really appointed milestone and accomplishment that IHS has been able to deliver. Our agency has been able to get vaccines since December 15th, and we've been consistently getting allocations sent to us on a weekly basis. As a result, we are turning these vaccines into scheduled appointments and getting people vaccinated as soon as we can get it. So IHS has done an amazing job, given all of the difficulties it takes to deliver and administer vaccines at such a high level. We are doing the same thing, and we're trying to maximize our effort. That's why next week's event is so important, because I'll show you why the numbers are starting to turn in a good manner. Worldwide, 115 million individuals, almost 2.6 million fatalities. Here in the United States, 28.5 million cases. To date, 354 million tests have been conducted. That's more than one person here in the United States, which is actually kind of amazing. 515,000 fatalities. Here in Wisconsin, 565,000 with almost 6,500 fatalities to date. Now, what's important, as I mentioned about IHS being able to deliver vaccines, and what is the impact, and we're starting to see that impact occurring right now. As of March 2nd, we have aggregated total number of tests being done with the total aggregated roll-up of the number of positive cases. What I do for you is take moments in time, 7 days at a time, and I give you what are the new cases that have been going on per area per week. And as you can see, across every area, the numbers are going down. We have Billings, the Billings area, 6 cases last week. Tucson, 8 cases last week. Navajo is down to 153. Oklahoma's numbers have dramatically dropped, 305. Phoenix numbers, 110. What's even more powerful in these numbers is that over the last week, there's been only 1,150 new cases documented within the Indian health system. Now, I've been reporting these numbers out for months and months and months. All the way back, I think I started since June of last year. And I've looked over these numbers. I said, I couldn't believe that we're down to 1,150. And I had to go back. We haven't been at this level. And this goes all the way back. Even before June, we haven't, that's how low these numbers are. And so I've been mentioning and talking about how, what a successful job IHS has been doing. Now this is as of March 1st. And again, we're looking at the distribution of vaccines to all of these areas. We can see that Bemidji has 52,000. That's us, Wisconsin, Michigan, Minnesota. 43,000 of those 52 have actually been administered. And as of March 1st, IHS was in the top 10 of receiving at least 1 or 2 more doses. Now, people familiar with the Indian Health Service, this includes federal, tribal, and urban sites throughout the country. And we know that there are challenges and difficulties in not only how we provide care, but also the locations where care is being delivered. We know they are in the most rural areas, the most remote locations, and an infrastructure that is spread out throughout the United States. That's a huge system. And one of the, I worked in the IHS. I worked in IHS as a frontline internist for over 10 years. We always managed to do more with less. Not because we wanted it that way, is that we had to do it that way. And we provided the best possible care. IHS has been doing a great job in ensuring the allocation of vaccines get to every portion of its health system. And we're part of that. And as a result, we're turning this over to the Native community in Milwaukee County. The cases that are ongoing right now in Michigan, Minnesota, Wisconsin, based on the respective tribes, the population of these states, we see that Michigan has a rate of 5.13. Michigan is 5.13. Minnesota is 6.11. Wisconsin is 12.25. And as you can see, looking at the trends over the last 2 to 3 weeks, that trend, that rate of increase is slowing. Even here in Wisconsin, the rate of increase is slowing. Now, as I was going through preparing for this, I was looking at where in Wisconsin are we seeing cases or lack of cases. 3 counties in the state of Wisconsin have actually 0 cases for the past week. Forest County, Florence County, Menominee County. As of yesterday, there's been no cases documented in those counties. And so that's 2 tribes. That's the Menominee tribe, and that's Forest County, Potawatomi. They've been vaccinating. They've been having huge campaigns in vaccinating their tribal members. I know that the notion of going back to school, and I took a moment to look at what kind of school districts in the state of Wisconsin, what kind of case rates are we looking in Wisconsin. And there are too many to count. There's at least 10 times as many school districts without cases of COVID in the past week. And you can look at this slide and you can see all of the pocketed areas of white. These are the counties, the school districts, and the counties that have no cases. So throughout Wisconsin, the cases are decreasing. And there's explanations as to why that can be, and there's several, but vaccines certainly have an impact. And the dramaticness of such a reduction. No cases, that means no hospitalizations, no ICUs, no fatalities as a result of this virus. We're looking at the impact of hospitalizations. We look in the Southeast region, there's 117. That's a dramatic decrease. The Fox Valley, 14 cases in their hospitals right now. I use September 9th as a benchmark because that's when that big surge initiated. And as you can see, the number of cases, they keep going down. Hospitalizations, the number of cases in hospitalization are starting to recede. I mentioned last week that this point in time is kind of this critical moment. How do we get rid of this virus? How do we squash this virus in our communities? And it's vaccines. And we have those vaccines. And right now, we can't let our guard down or being complacent in this effort, because if we do, we're going to let this virus squeak out and evade the suppression of it. And we don't want that. It'll just linger. It'll keep lingering and lingering and lingering. So this point in time, it's critically important. The rate has decreased. We're now averaging 545 cases over the past 7 days, 7-day average. We haven't been this low since July 4th here in Wisconsin. And it's true throughout other parts of the state, of the country. I mean, but you kind of see that are we plateauing? Are we bottoming? Are we at that landing now where we kind of let it just linger and linger and linger? That's what I mean, is that this point in time right now is exceptionally critical in ensuring, and we're racing against time to maximize the number of infections that go out. One of the reasons why I set this in partnership with DHS was to assure that not only our elders, but also our individuals, our Native individuals, have an opportunity that they may not otherwise have to get a vaccine. And you can just look at the numbers. We look at age group 60 and older. We know they are the most vulnerable. I've been talking about for months how vulnerable the 60 and older. And if you have more chronic conditions, it even puts you at higher risk, not of just having COVID, but having severe COVID that renders you ill enough to be admitted to the hospital or to the ICU, and the impact to our families, extended families, of someone losing their life to COVID. The new age group that's going to be impacted is 50-year-olds now. The rates of infection for 60 and older, they're starting to go down, and that's what we want to see. The number of overall cases is going down. Hospitalizations are going down. ICU admissions are going down. But that new emerging age group is now 50 years old. That is the focus that we need to address, 50-year-olds. Individuals that didn't fit, they were in this in-between, young, don't get too sick, older, sick. We're talking 40s and now 50s. These are the groups that are now going to make up more and more cases, which means more and more hospitalizations and the risk for a poor outcome. Now, Mark talked about rates of cases, talked about rates of hospitalizations, number 2. Number 1, fatality rates. Here in Wisconsin, Natives are have the highest fatality rate of all races. Now, I dug around in the last 24 hours trying to kind of outline why this is so important, why this point in time is so critical. Looking at the last 30 days here in Milwaukee County, there's been almost 2,900 cases, 147 individuals hospitalized, 45 fatalities in the last 30 days. When you look at that middle section, what do you see? In that number of cases, there have been 12 natives who've come down with COVID, 1 hospitalization, and no fatalities. That's over the last 30 days. When we look at what's been going on in the last 14 days, the last 14 days, 3 native cases of COVID, 0 hospitalizations, and 0 fatalities. This is that critical period. The last 30 days, last 14 days is this critical period where we are racing in time to get ahead of this, looking at vaccinating the maximum number of individuals that are at risk so this trend can continue. that is why next week event is so important, and why I think more and more people should seriously look into this. We want to continue this trend. Like I said, we want to squash this. The more people we protect, the greater the chances of minimizing this even more. Because I'd love to see no native cases, no hospitalizations, and certainly no fatalities. So, Mark, Jeremiah, I'm going to turn this back over to you guys for any questions, any follow-ups, any comments you may have.
Sorry about the delay. Dr. Ignace said we do have one question in the chat. Jeremiah, could you take that one on? This must be one that's coming in from the health center, and maybe some calls that are being forwarded. Can you take this one?
Yeah, for sure. So we had a question come in from Facebook actually that was, and I think it's a Facebook friend of ours. I think she commented on our original post a few days ago, but was just asking about whether spouses of enrolled tribal members, so I'm assuming that that means that that spouse would not be an enrolled tribal member, would that spouse be eligible for this event? And then also, and I know the answer to this one, this is still just focused on Milwaukee County, but you know, with the possibility of maybe expanding that in further events.
Yeah, so Mike, the quick answer is not at this time. And the reason being is we're looking at addressing Milwaukee County, and you may fall into that. The individual may not be an enrolled tribal member, but I am anticipating that we are going to have a second round. And that second round is going to include individuals that didn't qualify the first time, but it will qualify for individuals in the second round, and that includes household members, which this would fall under household members. And so we are trying to do the best we can to accommodate as many individuals as we can. Just given the limited supply that we have, we're trying to target and kind of surgically look at how we can maximize the protection of Native individuals who are at the highest risk. And then highest risk includes not only the occupation, but also by chronic condition. So I would say be patient with us, because we are making every concerted effort we can to maximize and broaden our eligibility with our second round. So it's coming. I can't tell you when as of yet, but that I am anticipating and planning a second round to include additional counties and including household members. But right now, we're trying to make inroads right now to make to yield the highest effect of protection.
So Dr. Ignace, this question comes from a meeting earlier this week that I attended. It was attended by a lot of Milwaukee organizations and that are in healthcare. And one of the concerns we heard from Black and Brown communities was, well, now that this Johnson & Johnson is one shot and it's less effective, then marginalized communities are going to be the ones that are going to be getting that by and large, while other communities get the better one. You did address that in the beginning of our program, but it is worth revisiting, because that is word out there, which is, why should I bother? Because I'm going to get targeted by the government for less effective medication, so why should I even bother?
Yeah, you mean bother with the Johnson & Johnson?
Or right, or even just coming in because whatever my community is getting, let's say whatever neighborhood it might be that doesn't have the resources of others,
yep,
that's what I'm going to get. I don't know, they're not telling me anything. They just say, come in for a shot. And I know that the government's not going to be giving me their best. So why should I even bother?
You know, that certainly would be one perspective, and let me kind of put a twist on that. Now, when I talk about Johnson & Johnson only being 72% effective, and comparing that to Moderna, which is 94, and Pfizer 95. So really, when you look at the numbers, you know, even with Moderna and Pfizer, people can still get COVID. Okay, people can still get COVID even if they get that first shot. But I think what people need to look at, not so much as that number, but I think you need to look at in the long run, in the long term, beyond just the first couple of weeks. Yes, it does provide protection even after 14 days. All of them do, all the vaccines do. But when you're looking at past the immediate short-term benefit, looking at day 28, we know Johnson & Johnson has an 85. So immunity builds up with time. 85% of preventing severe COVID after 28 days. After 90 days, it has almost 100% or near 100% effectiveness in preventing severe disease and even fatality. That is the same as Moderna and Pfizer. So you have to look at the short term and the long-term benefits. It is the long-term benefits that Johnson & Johnson can offer people the same benefit as Moderna and Pfizer over beyond the first 2 weeks. We're talking 3 months. It has the same equivalent effect of prevention of severe disease and death. So, I mean, if you just look at the pure numbers, but you got to look long-term at this and what vaccines do. Because not all vaccines they're not going to be absolute, but they are going to be effective in severe disease, and that's really the outcome. I mean, people still can get it, and they may get a mild form of it, but ultimately, we want to prevent not only prevent infections, reduce transmissions, but also ultimately prevent deaths.
So here's a second question I got earlier this week, and that is, any updates on vaccination, pregnant women, effect on babies? I mean, we did talk last week about vaccinations in children, that's on its way.
Yep.
But this one just came in specifically about pregnant moms. What's happening with them?
So that is also part of their enrolled phase studies as well. So there's no formal recommendation out there for women during pregnancies. There's not enough data out there for the FDA to definitively give a recommendation. And same with pediatrics. You know, I had this discussion this morning about pediatrics. Those are ongoing enrolled clinical trials. They haven't completed them. They haven't collected the data on kids less than 16 years of age. And so I don't have any new information regarding those two categories of individuals.
Any updates? And there's like 3 update questions here. Hopefully they're simple, but again, that's why we're here. Native Conversations is folks had heard about a UK virus being more transmissible. That folks might need a booster shot. So contained within that is any word on booster shots, and local to Milwaukee, has there been spread from Waukesha into Milwaukee County on the UK virus? And where might that variant be in Milwaukee County right now?
Yeah, so I have not heard of any cases of the UK B117. I know there were cases, a case in Waukesha, and as of to date, there have been at least 6 cases documented in the state of Wisconsin. So I do want to make comment about that because I think people need to take that with a grain of salt. 6 documented cases of the UK B117. When we look on a weekly basis, or even on a daily basis, let's go weekly. So 5,000 cases, and there hasn't been one new documented case of the UK variant. When we look at the state have taken samples and the sequencing of people who have COVID, they're turning up more of the original virus and not the UK B117. Now, that's not to say it's not here, it is here, and we may not know the true number, but it's not as prevalent as people are actually claiming that it is. So to date, of all the cases that have been sequenced to date, of all of the cases over the last couple months since December, only 6 cases, and we've had plenty of cases of COVID during this time frame. So do take the variant with a grain of salt of how it's not widespread throughout all of Wisconsin. Very limited numbers. And one thing also that I want to mention about the variant is that even if this may be as contagious as papers have been documenting, the one thing about changes in a virus, in an infection and getting people sick, is that it immediately turns it around and it self-isolates, so to speak. So if you have a variant in a community and an individual gets sick, they quarantine and limits its ability to transmit and spread. We all know masking, hand mitigation, 6 feet distance and all this, but it's probably even more important, again, that critical time where if an individual was to get sick, that you maintain that isolation and quarantine. Now, as far as boosters, Moderna right now is developing a booster. And the good thing about Moderna is that it's the mRNA technology, which means they can modify against the variant, whether it's the UK, South Africa, and the P1. They can modify and reproduce this vaccine under the mRNA technology quicker and faster than all of the other traditional methods. They could actually flip this and turn this within a 3-month time frame, say, hey, we have another vaccine, a booster vaccine against the variants almost in real time. It's unheard of for vaccines to be developed that quickly, but it could. Moderna could, and they have that ability. So they're looking at if this variants, the variants of the UK, the 351, the P1, if that becomes the predominant infection in society, Moderna is going to have that capability to turn around and give that booster against these variants at a later date, if this is needed.
Here's a question. It was an interesting one about the flu and cold season. We do have some schools that are going to be starting up very shortly. More kids returning to school, more chances of flu and influenza. I know it's a little bit late in the season for this. I think the next cycle is May and June, but as children return, if flu and cold does come into the home, does that family, should they be more concerned, more putting that person more in isolation? Does flu, influenza make a person more susceptible to COVID-19? That's what I'm getting at. Sorry about that. That's the question, is as soon as that sniffle starts, do they go right into isolation or allow that to move just a little bit and see where they're at?
You know, right now, what I find really remarkable is how insignificant flu and cold is right now. Where the number of cases right now would look like as if we're in the middle of summer, where we hardly ever see flu or colds. I mean, it occurs, but obviously the traditional flu and cold season is usually from October to February. That's the most cases, the highest prevalence of cold and flu is during that time frame. Once we get into March and into the spring, those numbers start tailing off. But we didn't even have a spike. There's been no surge of flu or cold, and I don't anticipate there to be a surge of flu or cold moving forward. Yeah, no, kind of this point where, yeah, kids are going to go back. There's going to be colds, without a doubt. There's going to be colds. Now, whether or not having a cold or having a case of the flu concurrently, does that make you more susceptible to COVID? You know, hard to say, but I would think it's kind of one or the other. I suppose it's possible that you could have both. I don't know if having one makes you more susceptible to the other. But, you know, what we've done traditionally under flu and cold, yeah, if people get a test and say, yeah, you're not COVID, well, okay, it could be cold or flu. I don't know if we would necessarily have to go into these more dramatic efforts of quarantine, even within a household. You know, that's not what we've traditionally done before COVID. I don't see why we should be so isolating, even if individuals do get a mild cold or flu-like symptoms.
So Dr. Ignace, we are on our 49th show in our hour format, and we're coming up to the top of the hour now. So I'm just gonna beg your indulgence for a moment and turn it back over to you. And that's revisiting what I said earlier in our program. This is my words to our community. March 17th is coming up pretty quick. March 17th and St. Patrick's Day in Milwaukee, that's a big day for people going out. And that's just in 2 short weeks. And there, with a lot of people looking and thinking they see the end or light at the end of the tunnel with COVID-19, people kind of lift their own self-restrictions before governments do. And sometimes vice versa. But here in Wisconsin, it seems we can see the light at the end of the tunnel, and people get a little lax. And in front of this, March 17th is staring us straight in the eyes. And a lot of people go out then, just like Christmas. And in fact, you know, I think when it comes to going out, St. Patrick's Day is 9th in the country of holidays for people going out. Cinco de Mayo is right behind that. So what we have, community members, is 2 large places in our society, dates, where folks are going to be socializing. They're going to be out and about. We need to remember something. And these are 2 things. One is, what is institutional racism? Institutional racism is in this case, in what I talked about earlier in the show, is this: oh, hey, we're all the same, and no one should be put above another. And that's not what any of this is about. When we look at the effects of COVID-19 in our community, we can see that in our small population, we're affected to a great degree, far greater than others. Even though our numbers might be lower, our population is lower, but it's affecting us to a greater degree. In Milwaukee, we have the largest population of Native Americans in the state of Wisconsin. These numbers continue, and we should be last. Our community is small enough. That means we have to get the word out. Number 2 in transmission and 1 in fatalities. We need to get those numbers down, and that's up to us. Obviously, if it's up to the leaders of our community, one of our organizations decided that they're not going to put word out about this COVID-19 vaccination availability. That is institutional racism, and we're doing it to ourselves. And again, I'm not going to out that organization, but it's easy to see. As Dr. Ignace talked about, the words have been out there 36 hours. And if your organization doesn't have word about this yet, you need to talk to your leadership. You need to say, as Dr. Ignace said, that healthcare decision in your family shouldn't be up to other people. It should be up to the person who can be affected. You know, we need to stand up for each other. We need to stand up for people that don't have voices in this. And our health center here in Milwaukee stood up for us. They've represented these disproportionate numbers. They've come with an answer before any other community as we can see it, as far as we can see it, an urban Native community in our country. And to have our own community members working against us, that means that we as individuals must step up and must reach past those institutions that say they're for us and get this word out ourselves. Because it looks to me like some in our organizations believe that it's too much trouble to put the word out, that this is only identifying some people who in fact are Native. And so they're not going to put the word out. I don't understand that thinking. I really don't. But it's out there. We have to address it directly. And the only way that this gets pushed back on is if we do it as individuals, to get this word out on social media, to make it a part of your conversation, that on March 9th through 11th, there's an answer here. And if you're not sure if you fit in, there's a phone number to call to get the answers to your questions. And know that there will be further answers along down the line. This isn't just a one-shot deal, so to speak. There's going to be other opportunities, but right now, this is what we can do. So I'm going to step back from this because I am angry. I am angered by this. And this is a Native to Native conversation. This is me asking you that visit this program after we broadcast it. Spread the word. Let people know. Because some of our organizations aren't going to do it. Dr. Ignace?
Thanks, Mark. Thanks for those words, because I think it's important. You know, we talk about effort, we talk about information, and I've always tried to be direct and objective about providing information. I give numbers. Numbers are numbers, and numbers don't lie. I've been affected by COVID, just like many of you have. And like I said, this is an opportunity. We haven't had something on this scale for the greater community as a whole than we have right now. And, you know, the state helps. They get involved in organizations like ourselves and other tribes, but not such a willingness to help the Native community. Their willingness to partner, their willingness to assure that Native communities like the ones we have in Milwaukee have that ability. And I'm all for that because I know what it can do. I know the impact of what a vaccine can do in prevention of not only getting COVID, preventing transmission, and preventing an outcome none of us want. So do feel free to spread this information. Pass it on. If you know someone who fits into these categories of 18 and older with a chronic care condition that fit in 1A, 1B, 1C, that has not and wants to get a vaccine, call us. Go online. You can pre-register. I do insist that you do register before you show up. We won't take walk-ups, but you must pre-register if you want this vaccine for your loved one or your family that you know is at risk, who would benefit and maybe has no other means or capability of getting a vaccine. This is this opportunity. And we'll have more. It's just when. Is that in 2 weeks? Is that in 3 weeks? I just know the moment is now where we have that supply to meet the demand. And I hope you consider, as I've been mentioning, you're going to get a call one day. You're going to get a call one day and it's going to say, hey, you're up for eligibility. Do you want to get that vaccine? It is a critical time right now where we can push through this and not plateau, not be on that landing for months and months on end, letting this linger on this is that critical moment where we can get on ahead of this and squash this even more. So I implore you to call, register, not for yourself, for a family member, and do take advantage of this moment. So, Mark, I appreciate your commitment and your passion for the health of Milwaukee's Native people. And I do implore people to look into this and pass this information on. So I'll give you an update next Thursday. It'll be the last day of this 3-day event, and I will give you an update on how this rolled out and how it went. So until next time, everyone, stay safe and stay strong.